compromised blood flow to the heart, blood clots to the lungs, trapped air in the chest, and a torn aorta. All four are life-threatening in the short term. Impaired blood flow leads to death of the cardiac muscle. A big enough blood clot stuck between the heart and lungs can lead to cardiovascular collapse. Leaking air from the small air sacs of the lungs builds within the chest cavity, causing pressure to rise, compromising blood flow in the mediastinum. The aorta transmits blood under high pressure to the torso and limbs. Its wall has 3 layers. If the inner layer tears, the force of the blood flow can rapidly increase the size of the new potential space, blocking circulation down to the kidneys, leading to kidney failure, or back up to the heart, causing a heart attack.